The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health live stream. Glad to have you with me again. This is Dr. Tom, obviously, and we're going to have a kind of a continuation of what we did with the last program, and we're going to talk more about your immune system, the viral patterns that you're exposed to, but very specifically, how do you know when you're sensitive, when you're more susceptible, when you have a greater chance of coming down with anything, but specifically viral patterns. As I've said before, we're in an environment today that everybody still seems to be afraid of this craziness that took place about 4 years ago or so. And this COVID-2 viral pattern that caused a lot of deaths and so forth. You know, there's a lot of pieces of that puzzle we could get into, but what I really want you to understand is the body's immunological responses, when they are appropriate and strong enough and present the way they're meant to be, they should be, you just don't get sick. And if you do, you end up getting a mild version of something. Now, there isn't anybody at this point that hasn't been exposed to this viral pattern. I promise you that you all have run into it, bumped into it, and those of you who've never been vaxxed and you haven't had a problem, it's because your immune system is working the way it's supposed to. And some of you who have had the vaccines and the things that you thought were going to protect you have gotten sick again, and sometimes several times over and over. So what we want to know is we want to know what happens when somebody is really in a good place and somebody is in not such a good place, and what you could do more importantly to help yourself. You know, it really hurts my heart when I walk around, airports, and I'm traveling and I'm in hotels and all over this country teaching, and I see people still masked up. They still have their masks. And I'm saying, my God, why are you still in these masks? Did you wear them before COVID? We still have the flu out there. We still have the common cold out there. We still have all of these other viral entities, and we're masking, and we know that they don't work. They don't protect. Even the N95 masks that are supposed to filter virtually everything out, they don't fit solidly. And if they did, you'd pass out. You're not getting any oxygen and airflow through your body. So I want to just kind of leave you with that. But here's what we're going to do. We're going to get into what susceptibility that you may not be aware of and what you can do about it. And we're going to continue the process because I want to give you the tools. I want to give you the things that you can get to do. But before I do that, I want to remind you of a couple of things. One, those of you who are catching us on live stream all the time, remember that we do a radio program just before this on WMAL 105.9 in the Washington metropolitan area. It's the largest talk format in the Eastern Mid-Atlantic area. So join us 12 o'clock every Sundays. It's 105.9. Secondly, please follow us on all your social media sites, whether it's Instagram or Facebook. You can find me. You can you go to YouTube and Rumble. Follow me, and we'll let you know when we're doing anything that you'll need to have that information, that data, and make sure that happens. And those of you in the Washington metropolitan area, I want to remind you that coming up on the 12th of June at the Roselle Center in Fairfax, Virginia at 6 p.m., we're going to do a night on chronic pain, fibromyalgia, what it really is, what it isn't, what you can do about it, can it get fixed? The other day I was confronted with a patient who came in desperate. And this young man was told by his physician that there was nothing that he could do about the fibromyalgia and nobody else could do anything about it. That's not the truth. Many years ago, I wrote a paper. It was quite in depth, and it was called Fibromyalgia, the Undisease. You've heard me talk about it a couple times. And on the 12th, I'm going to get into the nuances and what this is and how to fix it, what you can do about it, and that you really don't have to live with it. Minimally, anything can be made better. But in most cases, if you understand the process, you can turn things around. So let's get into the program today and let's really understand this susceptibility piece that we need to know a lot about, whether it's the measles virus, whether it's the COVID virus, whether it's the cold virus, whether it's the Epstein-Barr virus, whether it's a mononucleosis virus, whether it's a herpes virus. Obviously, the list goes on. And the truth is that it is. If I've told you before that if we did a complete panel on exposures to viruses, all of us would test positive for about 125 different viral entities that we've been exposed to over a period of time, and we don't get sick by them. So let's get into the little bit about what that's all about, why it's all about, what we can do about it, and how do you know if you are susceptible. So susceptibility to viruses, if you will, and viral diseases are influenced by a lot of different factors. Number one is genetics. Genetics meaning not that, oh my God, I'm gonna get every virus, but it's all types of immunological situations. Some people are just genetically tougher and stronger than others. But we do a really good job of destroying that susceptibility over a period of many years because of viruses and so forth. Then we see this adaptation, if you will, of different viral patterns and things that should be there that are not, that protect us. So what we want to do is we want to make sure that we understand what a weakened immune system is. And, a weak system, if you will, a weak immune system increases your risk of infections of all type, but it can take it to a place of, even if you get it, you have a greater chance of being very severely affected. I'm going to tell you a real quick story. When I was in professional school, I was taking one of mandatory classes. Obviously, it was microbiology, where we had to study the effect of different pathogens on the body. So it was intense. A good night's sleep for me was 5 hours. I had, a son that was born while I was in school, and classroom time was about 28 hours a week, and then double that with the amount of studying that we had to do. And then I was also working for a doc, doing a preceptorship in his office in the field, and all kinds of things. So the last assignment was that we had to come up with 4 different growth cultures, if you will, of different types of organisms. So I had 3 of them, and I was rushed for time. So what I did is I took a cotton swab, I went in my throat like this, and I plated it on the petri dish and shoved them in the incubator. And I came back, 24 hours later, and I pulled them all out and I had to write reports and colors and susceptibilities, identify them and so forth. And my instructor comes over and he's looking, he says, "Where did you get that one?" And there was the one that I took from my throat. And he said, we don't have that in the office or the laboratory. And I said, "No, that came from my throat." And he said, "How do you feel?" And I said, "Fine." He said, "Yeah, you're probably not going to." Within 12 hours, I had a raging fever. I had a throat that I couldn't swallow anything. I was burning up. I was living on the floor. My classmates and several doctors, I was home for like 3 days. And they came and they treated me with acupuncture and herbs and homeopathics and so forth. And fortunately, I pulled out of it. So why did I get sick? Because I don't have a history of getting sick. I just don't. My body's immunological system seems to be pretty stalwart in what it gets done. But, when something like that happens, there's a reason. Well, part of the reason was, as I told you earlier, I was pushing, no downtime. I wasn't sleeping. I wasn't resting. And then you have, your environmental stressors. Part of what I just told you about was my stressors. So it has an impact. The environmental conditions. Are you living in areas that you're being bombarded in today's world by all kinds of electromagnetic fluxes that they come into the system? Are you always on your cell phone? Are you always on your pads? Last week's program, I told you about what took place in Davenport, Iowa during the Spanish flu back in the early 1900s, that people who were treated with upper cervical mobilization manipulation adjustments in the chiropractic arena had huge viability and protection and preventing diseases, and they didn't die. It was unbelievable. But those were the statistics, and they're very well recorded. You can go to the Palmer College of Chiropractic in Davenport. You can ask them for the data. It's there. So what happens if you're constantly in a downward position like this? Your neck, your cervical spine reverses itself, and you always have that little pressure at the back of your head. And you walk around, you move around, it gets a little bit better, but that is always, it's compromising your body's ability. You have at the lower portion of the brainstem and the upper portion of the spinal column, you have something called the RAS, or the reticular activating system of the body. And it has a host of things that it does. But one of the things it does is it finger points to different systems, and it allows the body to work opportunistically. And it controls the ability of the body to go into parasympathetic healing, if you will. And if that's not working, you can't heal from anything. But we'll save that for a different platform, a different program. So what we have to do is we have to understand these viral susceptibility patterns. So we talked a little bit about human genetics, right? And so when we look at this, there's a huge body of evidence that identifies different locations, loci, if you will, in the genetic map within the body. And these loci, these little areas, and I think there's 13 of them, influences your risk levels when it comes to any viral patterns. So a weak immune system across the board just genetically increases your risk. So now what are you supposed to do? Well, you have to begin to take care of yourself relative to the things that we talked about, eliminating, modulating the types of foods that go in your system. The sugars, the sodas, the coffees, the black teas, the fast food, the fried foods, the alcohol, the gluten, the additives, the genetically modified substances that are out there. All of those things have a tremendous impact, dampening your immunological responses. So if that's the case, catch as catch can, meaning, well, I'm just going to grab something, I need a candy bar because my blood sugar is dropping, increases your body's risk level to anything that you're trying to stay away from. It's not okay. You know, we've said that your part of your primary immune system is your white blood cell activity within your system. 1 teaspoon, of sugar or sugar type substances decreases your white blood cell ability to work something in the neighborhood of about 12% for a period of about 8 hours. It doesn't kill the white blood cell. It knocks it out. It makes it comatose. It puts it to sleep. So now this incoming viral pattern or bacteria or something else kind of looks at it and says, oh, hi, but it doesn't do anything to get rid of it. So when you know that you can begin to protect yourself by altering the types of foods that go into your system, why wouldn't you do that? Why wouldn't you make the difference? So when you're dealing with viral susceptibility and you're dealing with immune response patterns, wouldn't it be important, if you will, to do everything you can and learn everything you can about it? And we're going to talk about that just a little bit today. I'm going to give you some tools. And next week, I'm going to have a brilliant doctor, a very dear friend, somebody I've known for over 40 years, be my guest on the program, Dr. Jeffrey Weber, and we're going to talk about very specific applications. So make sure you join us and make sure you tell your friends about it. You're going to enjoy this guy. He's amazing. You know, we're in the same world, but he always comes up with little pieces of the puzzle that I've forgotten about sometimes because we're so multidimensional, but we're all going to learn by talking to him. So when we're dealing with these genetic patterns, and we see variabilities. There was a study that was done and published in a book simply called Nutrition. The author was a medical physician by the name of Thomas Ballantyne, and it goes back years and years and years ago. But what he did is he took people, twins or brother or sister, from out of the country, and he, looked at their dietary patterns, and he saw what their health index was. I mean, had they been sick? Had they not been sick? What kind of sicknesses they had, and so forth. And in each one of these cases, they had gone somewhere else. One stayed in their natural environment, in their area that they were born. The other one came to the Western culture, came to the United States. They went to, other places like us. And he watched them for a period of time. And what he saw was huge maladaptations, bad adaptation of the people that moved into Western culture because our food supplies are so modified. Our environments are so stressful. Our inability to understand what really goes on in the body has been dampened down to the point where we're almost stupid about it. And he showed how these people that came here into Western culture were sick and more types of sicknesses and more repetitive sicknesses than people that other than that were back in their own environment, their own countries, and their own homeland. So when you see something like that evidentially, meaning there's pictures that showed them, and how they had changed, you actually saw bone structures that were very different. Somebody who had a very broad base smile and their teeth were solid. And the brother or the sister, the twin, came here and their facial arches were collapsed and their teeth were, had cavities and they had more infections and so forth. So that should get a heads up and say, hey, there's something going on here when you look at this stuff, and you can't say, well, it's not going to happen to me. Well, it can happen to you, and you have to understand that you have the ability to put up with things or you're going to kind of crash, right? So we want to make sure that you have all of that data. And so let's get into it a little bit more and talk about this craziness, is this susceptible plague. So let's talk about rejuvenating the immune system and why things begin to break down a little bit. So if I use the term rejuvenating, that means upregulating. That means to make better. That means to make younger, right? So rejuvenating the immune system can have a profound, very profound effect on the overall health system. And guess what? Your longevity, how long you get to hang out on this planet called Earth. But in a good way, not just debilitated that you're, in a bad place. We're in an era, if you will, of understanding how the body begins to rejuvenate itself under the best conditions. And what we're talking about is your internal immune response that has to do with your genetic expression. And rejuvenating that immune system has a profound effect. Overall health, as we said. And what we're looking at is we're upregulating stem cell production within your body, stem cell, exosome, and the things of that nature. Now, a stem cell in this natural state is an undifferentiated cell that can be made very good and expressive and supportive of other pieces, or can be made very bad and degrading and takes things down, or just doesn't work to express itself. So when we're looking at stem cell proliferation in the body, we have to understand the mechanism of how to make that happen. And we're going to spend some time as we go through this process in a couple of programs, and we'll talk about it. We're going to talk about things like NAD. We're going to talk about things like Lucitol. We're going to talk about things like Stemtor. We're going to talk about things like glutathione. And we're going to show you how to go into in many cases, something as simple as a fasting pattern, eliminating things that are not good for you, and upregulating that system and expressing and regrowing, if I can use that term, your own innate stem cell production and production across the board. So when we understand that that can be done, then the next step is, how do we do it? And we're going to talk about that. We're going to show you exactly what can be done. I want you to continue to listen and go into the archives to listen to some of our old programs. But we could talk about this for hours, and I want to make sure that I give you the data. So we're going to talk about stem cells. We're going to talk about activating them using certain substances. We're going to show you how to dampen down the degradation of your body's inability, if you will, becomes unable of producing what it needs to produce. There's other pieces of the puzzle. We have to look at the key factors, if you will, in simple things in modulating immune expression. And through COVID, you heard about, vitamin D, and you heard about, zinc and things of that nature. Well, simply taking enough vitamin A, enough C, enough D, omega fatty acids, a little bit of melatonin, but also very importantly, a good natural probiotic. Why is that? We've often said that the immune system is 75, 80% in the intestinal tract, but that's your microbiome. That's the good bacterium. That's why it's so important to have the right bacterium. And we test for that all the time. When patients come in and we do what we call complete diagnostic stool analysis, which is a fraction of all the good guys and the bad guys that should be living in your intestinal system. And then we can opportunistically fix those things, enhance the immune response the way it's supposed to. So those little things. So why vitamin C? As we told you many times, it increases the cellular ability to produce interferon, which is a natural antiviral. That goes back, as I've said, to Linus Pauling's work. Now, why D? Well, we found that in COVID, people who had functional medicine adequate levels of vitamin D were able to express strong antiviral development, if you will. So vitamin D, how much? Well, in my practice, I try to get patients into the neighborhood of 80 to 85 to 90, even up close to 100, because the new functional medicine guidelines is that 100 is not a problem. If you look at traditional laboratory findings, they're going to say 100 is too high. You got to keep it down. 32 is enough. Well, it's not true, because 50 is the beginning marker as far as I'm concerned. 49 or less is highly insufficient when it comes to vitamin D. 32 or less is extremely deficient. You're an accident waiting to happen. That means you're going to fall, you're going to break something. And so we want to upregulate that. Your vitamin A, omega fatty acids, your melatonin. Melatonin is not only to get you to sleep and downregulate or allow your body to go into a relaxed state and upregulate your different pathways that are tied to it, serotonin and dopamine. In the beginning, 5-HTP, which is the next step after tryptophan. So melatonin is a tremendous immune support. There's a book by a dear friend by the name of Dr. John Lawrence, and it's called The Melatonin Miracle. And I think that you would enjoy reading this. It's online. You could just look it up. Melatonin Miracle, Dr. John Lawrence. And he's been a guest on our Ageless Health live stream. Brilliant, brilliant doctor. And I think that you'll get a very different insight where, people are afraid to take high levels of melatonin. Dr. Lawrence will use, in some cases, up to 400 milligrams of melatonin. Methylene blue. We've all heard that. It seems to be the rage. What it does, it decreases inflammation, increases your immune reaction if it's used in conjunction with red light. Red light activates it. And we're going to get more into that and give you the pieces of the puzzle that you need to know about so you understand how this stuff works. So when we go into an antiviral, we'll call it a program, antiviral program, we have to really understand what it is that we're looking at. So there's things called cytokines, and they're produced in your fight-flight system, in your adrenal glands. The adrenal glands sit on top of your kidneys, and they put out all kinds of things, but it's the inside adrenal medulla. And they help produce lots of stuff, including, by the way, hormones, but they also are immunologically protective in viral infections and help maintain overall immune function within your body. There's a part of the immune system you've heard me talk about. It's called IgA antibody. That's an adrenal-driven immune response, and it's a mucus secretion. We call it the picadors. It's the first line of defense. It's from your mouth to the tail end of your body, and it's triggered by the adrenal system activating those mucus responses. Now, if that IgA level is low, you can't protect yourself from virtually anything, whether it's a virus or whether it's bacterium or whether it's heavy metals or any other inflammatory reaction. So what I want you to understand is this is all tied together. It's not about wearing a mask, because what happens is that you're decreasing your ability to protect yourself. You have to have these little buggers invade your body so you can upregulate your system. Why does somebody go out and have, all the fun in the world and never get sick, and they're a hugger and they're a kisser and so forth? Yeah, my Italian background, that's who we are. And they don't get sick. Why? Well, they've been around so many different things for so long. And if they eat well, they exercise well, they sleep well, they take the time to vet the types of foods that, that they need, and they treat themselves properly, their immune system is strong. Let's talk about children. Mothers who breastfeed, their children are much stronger than they would if they didn't, because in the first 30 to 45 days, the mother produces colostrum. That's what mostly the breast milk is all about. And that gives the child its initial protection for the first year of their life. Children who are not breastfed have more susceptibility to many different things. You'll find this, if you just do the research. So, but it also has to go to this. Whatever mom eats, the baby is getting through breast milk. So if mom's a sugar junkie, not only is the baby's getting good stuff, but the baby's getting some bad stuff too. And we have to understand that it's an ongoing process. We know, and we teach our patients, our mothers, that if they want to fix the baby's problem and they're breastfeeding, they're nursing, we give the mother antivirals in homeopathic levels. We give them other pieces that support immunological response, and they pass that on through the breast milk. Now, having said that, I'm drawing this for another reason as well. If you are drinking dairy products, something from a mammal, and these cows are not, they're not organic, and they're lot fed, and they have a lot of junk going in them, and they're vaccinated, and they have all these things from their body, you're getting that by drinking their milk. You're breastfeeding from that animal, and that's going to cause you issues over time. You're breastfeeding by drinking the animal's milk, by eating the cheese that's made from it, and so forth. So if you're going to do something like that, it has to be organic, free range, 100% field grass-fed, and so forth. And it has to be raw, because as soon as you modify it by heating it, it changes the structure genetically, not only of the calcium that's in there. It goes from an organic structure to ionic structure, which you can't get through your system very easily. But it also decreases the body's immunological response. Milk is not a bad thing if it's raw and it meets those other criteria, but it has to be. The rest of it is garbage. Don't touch it. It's not one of those things you want to deal with. So we're dealing with multiple levels of the antivirus. So I've given you a lot of data today. It's like, watch what you're doing with your health environment. That means, are you sleeping? Are you eating the way that you should eat? Are you, keeping the stress patterns under control? Are you exercising and walking? Are you calming yourself and waking up in the morning? The first thing you do is maybe get a glass of water and then sit. I start my day with meditation and prayer every day. Are you doing those things? If not, how can you begin to change it just a little bit? How can you begin to be respectful to that beautiful environment called the human body, your system? If you take a few minutes and change a few things, if you start taking some vitamin C, if you go onto our website right now, and you go to drtomroselle.com and you go to Asia's Health Store, you're going to see some products that we put there just for you so you can help yourself and upregulate your immune system. I promise you there's nothing on there that's junk, and they do a nice job of keeping you strong. We're going to be adding other products to it as well. but do little things. Make sure you're getting vegetables. Get rid of the carbohydrates that are refined. Most of us, because of the modifications of our foods, are so susceptible to grains, and we end up swelling, inflammatory reactions. Inflammation equals acid. So when that's the case, do little changes, a little bit here, a little bit there. As I told a patient yesterday, only exercise I want you to do is go outside and go for a slow walk first thing in the morning. I don't do that. I said, look, 5 minutes out, 5 minutes back. She said, 5 minutes? I said, 5 minutes. I said, you can do that, right? Just 5 minutes. Go down, slow walk down the street, turn around, come back. And I said, next week, add a minute, maybe 2. And you go 6 minutes out and 6 minutes back. And then a week or later, you add another minute to it. And then we're going to put her into just some motion and letting her arms move. And maybe we'll put a pound weight on each hand. And she'll start getting some activity. And I told her, I said, don't put a mask on. She says, I don't. I said, well, just reminding you, don't do that, particularly when you're out there by yourself. You want the fresh air, and you also want the exposure. We're going to continue giving you more and more pieces of the puzzle because it's important that you know how to protect yourself. And those of you who are in many areas, go get good chiropractic and acupuncture care. Talk to people who know what they're doing. If you're in our area, call the Roselle Center, and we'll help you out. Go on our line, Ageless Health Store, and I promise you're going to find a lot of things there that can support you. If you have a question, send me a note. You can do it through drtomroselle.com. Just send me a note, and I promise you I will get back to you, and I'll tell you if it's an opinion, or I'll tell you whether it's fact. I'll tell you what to do. If you're in a different area of the country, I will refer you to somebody that I would trust with my own family. I wouldn't just say, hey, go find. I will tell you who I would trust. We're here to serve you. And remember, on June the 12th, it's a Wednesday night, 6 p.m. If you're in the Fairfax, Virginia, or the Washington metropolitan area, and you want to find out how to get rid of that fibromyalgic pain or that chronic pain pattern that just doesn't seem to go away and get off the drugs that you're on, here's your opportunity. You can register online. You can go to rosellecare.com or drtomroselle.com and make it happen. Be our guests. And remember, we do all of these programs on an ongoing basis for one reason and one reason only. It's simply this. I love you all. Have a great week. We'll see you next week on Asia's Health Livestream.